Hi, folks, and welcome to another episode of Health Talk from Marz. It's out of this world. In today's episode, I'm going to talk about a very important vitamin, and that is vitamin D. Did you know that vitamin D is actually a hormone and has a profound effect on your immunity and also your mental health? Stay tuned if you want to learn more. So, what is vitamin D? Vitamin D is sometimes referred to as the sunshine vitamin. The reason is that the sun, more specifically ultraviolet radiation from the sun, comes down, hits the skin, and converts cholesterol into something called cholecalciferol. So this cholecalciferol gets transported to the liver, where the liver hydroxylates cholecalciferol into something called 25-hydroxycholecalciferol. Finally, this compound travels to the kidneys, and the kidneys hydroxylate this into something called 1,25-dihydroxycholecalciferol. This is the final step in making the vitamin D active. All mammals on Earth go through the same process to make vitamin D. Kitty cats you see lying in the sun, and they often lick their fur. Well, the fur basically has cholesterol in it. And as they lick their fur, they get a certain amount on their tongue. And that is actually the vitamin D that's manufactured by the sun hitting their fur. So we don't supplement vitamin D normally unless you have a lack of sun exposure. And so many years ago, it was very common to see something called rickets. Rickets is where you don't get enough sun exposure, and as a result, the bones become soft. So there are a number of symptoms associated with vitamin D deficiency, one of which is mood. Mood regulation is a very important phenomenon that vitamin D has an important role on. Number two, we see that it's involved in your immunity. So people that have lower levels of vitamin D have increased risk of developing cancer and also developing infections and more severe infections. Vitamin D, of course, is involved in calcium metabolism as an intimately involved in bone health. So that's an important feature that most people know, that vitamin D is related to their bones. So how do you know if you are vitamin D deficient? Well, there's a number of symptoms associated with vitamin D deficiency. One, decreased immunity. If you find that you're getting sick frequently, this is one sign that your vitamin D levels may be low. Also, your mood. People that are depressed oftentimes have a vitamin D deficiency. Loss of cognitive function and memory are also signs of vitamin D deficiency. So these are quite common in people. So knowing your level of vitamin D is critically important to determine that question. Are you deficient? The reference range for vitamin D used to be 20 to 100. They've upped it to 30 to 100. When we look at primates in the wild, bonobos, orangutans, chimpanzees, gorillas, they average 68 nanograms of vitamin D in their blood. So a famous researcher by the name of Michael Hollick wrote a book, The Vitamin D Solution. And in that book, he talks about what are the optimal levels of vitamin D to have in your bloodstream. And he believes the range is 50 to 70, which is similar to what primates have normally in getting exposed to the sun. So the problem with sun exposure is that most people are pretty much indoors all the time. So they're outdoors very little. The color of your skin plays an important role in determining how much ultraviolet light can penetrate and convert the cholesterol in the skin into cholecalciferol. If you use sunscreens or sunblocks, this also has an effect. But also the altitude that you live at. So if you live at high altitudes, you're going to get more sun exposure. You'll be able to make more vitamin D in your skin. Aside from the altitude, also latitude. So the closer you are to the equator, the more direct penetration, the ultraviolet light, and the more vitamin D that you can make. So vitamin D is something that's critically made depending upon a number of factors that are involved with your skin color, the latitude, the altitude, and also the time of year. So obviously, during the summer months, you can make a significant amount of vitamin D in your skin through the exposure of just as little as 20 minutes of sun. As you get closer to the fall and the spring, in those times, you're going to take a substantially more amount of time to make your vitamin D in the skin. So keep that in mind. So doing blood tests are probably the most important tool that we have in determining if you have the optimal levels of vitamin D. So, and if you're taking a vitamin D supplement, it also is critically important that you take that supplement during the time that you're eating some fat in food. Because it's fat soluble, it does require the aid of fats in your diet to make proper amounts of absorption of that vitamin D. I did want to add that if you are at high risk of colon cancer or prostate or breast cancer, it's been known that lower levels of vitamin D increase your risk of these cancers. So if you have a family history, you want to get your levels of vitamin D up at the high end. So vitamin D, as mentioned, is made in the skin, but you can get it from your diet. Most foods do not have vitamin D in them unless they're fortified. Certain fish will have a significant amount of vitamin D, which is why eating fish can be an important adjunct to your diet to make sure you get this critical nutrient. So what we also know is that mushrooms, interesting enough, make a significant amount of vitamin D. So mushrooms, when exposed to ultraviolet radiation with their pleats up, actually can make thousands of units of vitamin D. So how much vitamin D does it take to get your level up to the 50 to 70 point mark? Well, what we know on an average, it takes about 1,000 units of vitamin D to raise your level 10 points. So if you start at a 10, to get your level up to a 50, you're going to need about 4,000 units of vitamin D. If you want to get it up to 70, it's going to take another 2,000 international units. And those are rough estimates. And different people can absorb vitamin D at different rates. If you have a malabsorption syndrome, such as celiac disease, or ulcerative colitis, or irritable bowel syndrome, or chronic diarrhea, or parasites, this can cause you to decrease your level of absorption of vitamin D. So always check your blood levels to make sure that you're actually getting the proper levels of vitamin D in your bloodstream. In a previous episode, I spoke about vitamin K and its critical importance in bone health. Like vitamin K, vitamin D is also a fat-soluble nutrient that's involved in bone health. Oftentimes, we recommend supplementation of vitamin D and vitamin K together. That's why having a good multivitamin that has both vitamin K and vitamin D in there is of critical importance with regards to bone health and making sure that you get the right amounts of vitamin D. Again, check your levels in the blood to see if you're at those optimal levels. But both vitamin K and vitamin D should be taken with food that has fat in it to help maximize absorption. If you have problems with your fat absorption, let's say you've had your gallbladder removed, then it's important that you might need some digestive aids, some bile salts, in order to absorb properly those two fatty vitamin substances. So keep that in mind. Thanks for watching this episode on vitamin D. If you like what you heard today, hit subscribe and you'll never miss another episode. And if you want to learn more about me, you can go to marznutrition.net and check out my vitamin products. And thanks for watching.